Hello everyone, welcome to Talk Here with Dr. Laz, your favorite health program on television. From anywhere you're watching us, we're reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. You may recall that last week, if you watched the program, the topic was on health scams. Yes, scams in the health sector you must avoid, and that topic triggered a lot of responses. We received so many calls, even though we asked that you send WhatsApp messages, but a lot of persons chose to call, and a lot of feedback from persons who listened, and we really thank you for those feedback. But just note that we do not provide consultancy services over the phone, so for many who ask, we always ask you to meet your doctor if you have any health condition to evaluate you and tell you what to do. So just for those who might still want to ask questions about their specific health condition. So today we are continuing with that conversation, and we are going to narrow it to some of the shady practices that happens in the medical practice or within the hospitals in Africa. We are specifying it in Africa because it's not as if it doesn't happen elsewhere, but these are the ones we've observed in the course of our practices. And I have two guests. One of them is the same guest we had last week, the founder of ContraHealthScam.com, Dr. Obinna Ossai, joining us via Zoom. Both guests are joining us via Zoom. Hello, Obinna. Welcome to the program once again.
Hello, Laz. I'm glad to be back again.
Right. The show last week got lots of attention that even one of the Nigerian newspapers, had to pick stories from it to publish. And we're hoping that today's zone will even get much more responses. Also joining us from Enugu via Zoom is Chibueze Obi-George. He's a medical laboratory scientist. Chibueze, welcome to the program.
Thank you very much, Dr. Laz, for having me.
Right. We are going to go into the discussions after this short break. When we return, I know you can't wait to hear some of these shady deals in our hospitals. Do stay with us. We'll be right back shortly. Welcome back to Talking Here with Dr. Laz, your favorite health program on television. Like I explained before the break, my two guests joining us via Zoom, Dr. Obinna Ossai from Zaporizhia in Ukraine, founder of ContraHealthScam.com, and the medical laboratory scientist Chibueze Obi-George joining us from Enugu via Zoom. So yes, we think it's necessary to bring this topic to the attention of the public because the medical practice is designed to work in the best interest of the patient. But like everything we have human beings, majority of the healthcare professionals in Nigeria, in Africa, and around the world are excellent people who do their best, to provide services to the patients to the best of their ability. But like they said, in every 12, there are always a Judas, for those who are Christians might relate to that, so we still have some persons whose practice is not really what the profession deserves. And in this program, we feel we owe it to all our viewers around the world to know some of these practices so that you could take advantage of your rights and responsibilities to ask questions and be sure that you're getting the best. So we move right away. Let me begin with Chibueze. Chibueze, how will you describe a medical scam?
Okay. Thank you very much, Dr. Laz. I'll first of all define scam. Scam simply means fraud, So, and medical, when you add medical to scam, it means medical scam, and it is a scam that is being undertaken either by health professional or by health institutions for unlawful gain or to gain, to reap where they have not sown. So that's how I want to put it.
Okay. So let me read this definition you provided from U.S. Department of Justice, and thanks for providing this. It's a medical or healthcare scam or fraud occurs when an individual or a group of people or a company or a hospital knowingly misrepresents. Knowingly, it's intentional.
Exactly.
You know,
Yes,
or
intention.
yes, or misstate something about the type, the scope, or the nature of the medical treatment or service provided in a manner that could result in unauthorized or unmerited payments being made. So,
Exactly.
all right. Thanks for giving us that definition and background. So, as a medical laboratory scientist, one of the scams or shady practices had to do with typhoid and malaria. Um, you know, so the ideal practice is a healthcare, any patient that has a challenge should go to a hospital. You might meet a medical doctor, you might meet a nurse or a community health officer, depending on the level of the hospital you go to. And if they suspect that is malaria or any disease they suspect, they write out a test for you to do. You go to a medical laboratory scientist who will do this test. But what will happen is a lot of persons, when they are ill, goes directly to the lab. And if it's hotness of body, temperature above 37.5 degrees Celsius, at the lab they do typhoid and malaria tests, and many times both come out positive, and they will prescribe drugs for them. So can you tell us a bit about this and why this practice has continued, despite the fact that Vidal tests that they do commonly in the lab is a useless test when it comes to typhoid diagnosis?
Okay. Thank you very much, Dr. Laz. That's a wonderful background. Actually, first of all, let me make a disclaimer because whoever prescribes drugs as a med lab scientist is doing quackery because he's not a medical doctor, neither is he a pharmacist to give out drugs. So the main thing is most persons, they come to the lab without knowing what is wrong with them, so they need a diagnosis. So when they come to the lab, and the medical lab scientists, and they mostly they will request for malaria and typhoid because they feel it's a common test. And some, let me say, quacks or some persons who are not unpatriotic, some might not do the test. But I will not say that most of these persons that don't do the test, they might not be med lab scientists. Some of them might be people that are not well trained because actually for you to be a medical lab scientist, you must
Yes.
you must know that any test that you are requested to do, you must do it.
Yes, Chibueze, Chibueze, sorry for cutting you. The aspect I'm bringing is Vidal tests is shown not to be diagnostic test for typhoid. You know, why are people still doing it for patients instead of culture?
Okay, actually, some things make people not to do the culture test. Now, is in low resource places, you see, in fact, okay, let me just make this scenario. Most of the labs you see around, either not equipped, they don't have the equipment, they don't have the capacity to even do video to the typhoid culture. So instead of telling the patient that they can't do the culture, they will now just do the video and give the result as positive or significant as the case may be for if it's malaria. So the main thing is they lack the capacity. And when they lack that capacity
they'll
to
just
do it,
give what is
definitely it will result
available.
to fraud. Exactly.
Okay.
Exactly.
Thank you very much. Let me come to you, Obinna. I had to start with Chibueze because, you know, you were with us last week. So what I choose to call typhoid and malaria scam is very common, you know, and this practice has certain consequences. So taking it from where Chibueze stopped, what do you have to add to this, and what's the consequence? Even some medical doctors are the ones that will tell patients, go and do this. And they're also the ones that will prescribe antibiotics and anti-malaria for what they know that Vidal tests can be positive, even in the case of malaria infection.
Okay, I think the basic consequence of this particular test called the Vidal test for typhoid fever is the risk of developing antibiotics resistance, because, you know, these drugs that are prescribed to treat typhoid are antibiotics, and antibiotics can have like a double-edged sword effect in the sense that if you abuse them, they're going to kill off the good bacteria in your system. or
Exactly.
the bad bacteria in your system will become more accustomed to it. They will simply adapt to the actions of this drug. So at the end of the day, when you actually have the disease and you need the drugs no longer work properly. So that's the
Right.
consequence of, prescribing antibiotics when they are not actually needed. Like in the case of, our colleague said when he was talking about patients going to see the med lab scientists in their labs asking for typhoid and malaria tests. The right thing to do is actually to ask for like directions from the doctor, like prescription, because they normally write these prescriptions and say, okay, you need to do this so test. That's the first thing they're supposed to ask. But like you said, resource poor areas, they are looking for any means necessary to make money in the best way possible. And when they do this malaria typhoid testing, they are actually not breaking any law by doing that. So at the end of the day, no one can hold them accountable if anything goes wrong, because if something bad happens and they, like for example, face a panel, all they will say was that we simply did what the patient wanted us to do. And they are not medical doctors, so they're not held in the same high regard as people like us. So at the end of the day, it's the patients that lose. So that's why I think they still go ahead with the vital test, despite knowing that it's not going to be helpful for the patients.
Okay.
And since they are not even trained, they are not trained in medicine, prescribing medicine, how the medicines work, and all those things, they will never
They
know
might
that
not really
prescribing
know some of these
antibiotics
consequences.
is, has this kind of consequences.
All right, that sounds good. We had to spend this time because this practice is very common. On this program, around September last year, we had a whole program talking about typhoid. And the fever pattern in typhoid is usually step ladder. It keeps going up. But that of malaria is intermittent. It starts, it restores, it reduces, the next day it begins. So
Yeah.
even though their symptoms are similar, but they are not the same. And Vidal test, which many call Widal test, is usually positive for anything that causes fever. So it's obsolete and is not
Obsolete.
used for the diagnosis of typhoid fever. What is used is blood stool or urine culture, depending on the
But
period.
the
Right.
most accurate is the blood culture, because
The
that's
blood
where
culture.
the bacteria, the causative organism actually resides in the blood. So that's the
Exactly.
best, but it requires some time, maybe 2 weeks or a week, for the whole thing to be for the results to come out. You
These
get,
days,
but
within
vital
3 days,
test.
actually, you can get the results.
Yeah,
So,
depending on the lab that you use. But
right.
then viral test is still useful, but only in desperate cases, by desperate cases, I mean in a case where there is an epidemic, for example, and you need to test massively, to have an idea of giving preventive medication or something like that. But typhoid fever, thankfully, I don't think that's ever caused like a heavy
Epidemic.
epidemic
Okay.
that warrants the use
Okay.
of viral test.
All right, thank you. Yes, I think we've treated this very extensively. We're going to take a break, and when we return, we have to be very fast in the remaining aspects of the conversation. Do stay with us, we'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, we're discussing about some shady medical practices that happen in some hospitals. And like we mentioned, majority of healthcare professionals do what is required, but we still have few cases where some persons don't do the right things. And that's really the essence, because when it comes to medical care, we want it 100%. So don't take this discussion as a general practice. It's just exceptions, but it's good that you know. So Dr. Ossai, are you there with us?
Yes, I'm still
Okay,
here.
very good. So let's talk about what I call the diuretic scam. I don't want to use the name of the drug that is commonly used, on air, but
I understand.
the diuretic scam. So speak to it, because a lot of times you have some medical doctors do it, some quacks also do it a lot of times. Speak to it.
So the diuretic scam is this particular type of scam whereby someone with heart problems, or maybe, basically heart problems, something serious like that that requires a strong diuretic, comes
or
into,
body swelling, right? It can happen
maybe
in
swelling,
kidney disease, liver disease
swelling of
as
the
well.
limbs, you get, of the face or something like that. And they come into the hospital seeking for help. And then the hospital have done the necessary tests, and they understand that, look, this is actually a case of maybe cardiac heart failure or something serious like that. But then they will just say, okay, see the treatment. We're going to give you this particular diuretic. Just take it once a day, and then they'll monitor the person. Or maybe they don't even monitor the person. Who knows what they do? But the long and short of it is that the swelling goes down and the patient starts feeling better and will be like, yeah, everything is all right. And they simply discharge the patient without even doing the necessary long-term treatment that the person requires. So what happens is that after a few days, weeks, or months, the same patient returns to the same clinic with the same symptoms. Maybe this time it has become even worse. And then the clinic simply repeats the same old diuretic treatment, and the person has to pay for it each time, and the vicious cycle keeps repeating until something bad happens. And then most likely the patient dies, and they'll be like, yeah, well, we tried our best, or something like that.
Okay, so this particular incident, I observe it a lot among quacks. Some of them are male community health extension workers who pretend to be doctors. Some of them are also other non-professional. And it also happens even among some medical practitioners, some doctors who do it for the sake of making profit. So in this situation, it leads to death a lot of times because these conditions are organ failures. So what do you think could be done?
I think the only way to remedy this issue is to expose this particular practice, and whoever is behind this should actually face the law, because it's completely a medical malpractice. This is a case of medical malpractice, and whoever is doing it deserves to have his or her license revoked, and even serve some jail time, because it involves something drastic that actually can lead to loss of life. So I think that's the question for the regulatory bodies to actually look into and start seriously, clamping down on this practice, because that's the only way to solve this problem. That's one, no, not the only way, but that's a major way, something that must be done. And then number two is that all these things, I think we'll talk about it towards the end of the show.
Yes, we'll come to that. We'll talk more about some other recommendations. Yes, I quite agree with you, because the causes of these leg swellings are usually organ failures, whether it's kidney, the liver, or the heart. And for anybody to be treating symptoms and allowing the patient to be dying slowly and be making money off that patient is there's nothing more criminal than that. So let me get back to Chibueze Obi-George, medical laboratory scientist. So coming to the lab now, there is another shady practices that tend to happen a lot, especially when it comes to blood, issues around blood donation. And it has kind of eroded some confidence that people have. They give it as a reason for not wanting to donate, because they feel that when they donate blood voluntarily, that medical personnel use it for business. So what are those practices some of your colleagues, those that engage in that, do with blood that we should know about, and how can we stop that?
Okay, thank you very much. The issue around blood is a very delicate one, because blood transfusion is part of the medical practice everywhere around the world, because blood saves life. Like recently we celebrated the Blood Donor Day, and it showcased how important blood donation is in saving some patients that are in critical conditions. Actually, the blood donation services start from the screening and packaging of blood and giving the blood based on the specifications of the patient. You will now have the kind of donor you want that patient to have. So normally blood is not sold. That is, blood is not for sale. You understand? But because of blood is not for sale, you will find some persons, we have different kind of donors, the voluntary donors that just come to the hospital and the family donors. But we also have
and you also have
donors.
commercial donors, right?
Yes, we have also have commercial donors. Now, commercial donors, the lab scientists or the lab, they don't buy blood from them. That want to help that patient by donating the blood, and you give the person money for that blood he donated so that he can go and maybe recuperate. So that is the essence of commercial donor, not that you come and sell your blood and it's not sold in higher than the price or the money that you are giving to the donor. So what happens is some of the shady practices is that some patients, like the doctor will request, maybe you want to go in for surgery, you request for 3 pints of blood, and luckily for the patient, because I would say luckily or fortunately, the patient will not have to use
the blood.
That blood.
Right.
So that blood, yes, the blood that was collected from those donor or the voluntary donor cannot be given back to the patient because the patient don't have anything to do with it. The patient cannot even go and store it at home or anywhere.
But would the patient be refunded the money paid for screening? Patients are concerned that the money they paid for screening don't get refunded to them, and another patient comes and still pays before that blood is used for them.
No, actually, what happens in the lab is this. The normal practice is this: when you pay, the blood is screened. And is screened for infections like HIV, hepatitis, and so on. So the money was spent in screening those blood. So and a blood bag was used to package the blood. So you have to pay for all those services. So but when another patient come, you understand? What the normal practice? Now let me say the normal practice in teaching hospitals or
just round off very quickly, Chibueze, because we'll end here and we'll continue this conversation next week. So
the normal practice is. Okay, the normal practice is when you donate blood and it's not used, it's kept in the blood bank, and if another person, another patient comes that needs blood but can't provide a donor, that blood is made available for that patient. So that is the normal procedure. But some persons now use the opportunity to sell those blood instead of giving it free for those persons who are not opportune to have donors. Yes.
Exactly. Okay. Thank you very much, Chibueze. Gentlemen, I didn't want us to rush this because of the need for our viewers to really understand this and the context, but our time is up. We are going to end it here, but we are going to continue with both of you on this topic next week, and we're also going to discuss the solutions, because we just talked about some of the problems today. More discussion on the solutions will be provided. I thank you, Dr. Obinna Ossai from Zaporizhia in Ukraine for joining us, and also medical laboratory scientist Chibueze Obi-George joining us from Enugu. And we thank our viewers and the production crew for the show today. All right, so to our viewers, we'll see you same station, same time next week. Bye for now.